Hello there, Abby. It's good to see you again. As you know, my name is Chase. I will be your nurse practitioner student today. Before we start, you consent to being filmed and have this posted on YouTube for educational purposes.
Yeah.
Okay. And as I come into the room, I would wash my hands. And so today we're going to do a neurological assessment on you. So basically just going to be checking out kind of your neurological function and all your cranial nerves and stuff like that. So to begin, I'm just assessing her level of consciousness. Obviously she's alert, sitting upright. She's calm. And then I would also, I guess I'll turn this way so hopefully you can hear a little better. I'm also going to assess if she's oriented, her orientation. So can you tell me your name and date of birth, I guess?
July 11th, 1994.
Okay. And where are you at right now?
In Salt Lake City, Utah.
Okay. And what is the date today?
March 13th, 2021.
March?
April.
Hey, is what it is. And then what are you doing right now?
The video?
Yeah. Exactly.
Okay.
Yeah, no, that's perfect. Okay, so you are alert and oriented times 4. And so as I was asking those questions, I was also assessing her speech for any slurring or any difficulty, which there wasn't any. Next, I'm going to have you, I'm going to kind of test your memory, so kind of your short-term and your long-term memory. So first, I'll have you remember these 3 words, okay? So they're just going to be random. So we'll say pillow, dog, and baseball. Can you repeat those back to me?
Pillow, dog, baseball.
Okay, excellent. So now, can you tell me who the last 4 presidents of the United States were?
Like the last 4?
I mean, whatever.
Donald Trump, Barack Obama, Bush, and Clinton.
Excellent. Okay, and who's our current president?
Joe Biden.
Okay, excellent. And now, actually, let's, I'm going to assess kind of your reasoning. So let's say you're walking down the street and you find a letter that's been addressed and it's been stamped, but it hasn't been mailed yet. What do you do in that situation?
I would put it in the mailbox.
Okay.
Like the post office mailbox.
Yes, excellent. All right. That works. Now, can you remember the 3 words I told you?
Pillow, dog, baseball.
No, I'm just teasing.
Like, yeah.
No, that's correct. Okay, well, excellent. So next, I'm going to assess all of your cranial nerves. So we've kind of done similar things, but so first off, I'm going to assess your cranial nerve 1, actually, which is your olfactory. So I'll have you close your eyes and cover one of your nostrils or close it, and then tell me what you're smelling.
Mint.
Okay, and now close the other one. And what are you smelling?
Lavender.
Okay. Could you speak up for the camera, please?
Sorry, mint and lavender.
Okay, excellent. Mint, lavender. Okay, so that was cranial nerve 1. Next, we'll do cranial nerve 2, which is your optic cranial nerve. So first, I'll have you cover one of your eyes and read the lowest that you can.
LTFPH.
Okay, cover your other one. Read it backwards.
HPFTL.
Okay, excellent. And next, oh shoot, I should have had this ready, but I'm going to assess your retina for any abnormalities.
What if I had said that I was going to open the letter? Is that bad?
Failed. Let me see that. Probably.
Yes, Slytherin.
Yep. Okay, so again, right hand, right eye, my right eye to her right eye. So I'm just going to look at the back of your retina, dim the lights, all that fun stuff. So this one will just be a quick one. So red reflex, follow it in, and so again, I would just be looking, optic disc, looking for any hemorrhaging, and looking for any abnormalities, which I wasn't able to see, and yeah, looking for like a blurred optic disc or anything, which hers is crisp and good cup to disc ratio, and I'll do the same with the left eye here. So red reflex, following it in, and then I would, again, looking at the vessels for any hemorrhaging, looking at the optic disc, which I didn't view any abnormalities. So that's still cranial nerve 2, and next I'm going to do confrontation, which is cranial nerve 2. So basically, I'm going to just have my fingers in your peripheral vision and just tell me which finger is wiggling.
This one.
Okay.
This one. Both.
Okay.
That one. That one.
Okay, excellent. So that was good. Next, I'm going to assess your cranial nerve 3, your ocular motor. So we will do this in a few ways. So I will have you follow this pen light. So over here.
No.
Sorry. So just follow. Follow it. Okay. So assessing your ocular motor, cranial nerve 3, which was intact. There, I'm also going to assess your pupillary constriction. So first I'll do direct, which it constricted, and then consensual, looking at the right eye, it constricted as well, and then right eye constricted, and then the left eye constricted as well. There was one other thing with that. Oh, and I was also looking, as she was doing the ocular motion, I was looking for any nystagmus, which I didn't see any. So next, cranial nerve 4, which is the trochlear cranial nerve. So this one, I'll just have you follow my finger, the pen light, in here. Okay, excellent. So cranial nerve 4 is intact. Next one is cranial nerve 5. So I'll just have you close your eyes and tell me which side of your face I'm touching.
My right side. My left side. Both.
Okay, excellent. And then I will have you try to, you can open your eyes, but I'll try open your mouth. Okay, excellent. Against some pressure there. So cranial nerve 5, which is the trigeminal, I think I failed to mention that, cranial nerve, is intact. So cranial nerve 6 is your abducens, so this one would just be your eye movements laterally. So cranial nerve 6 is intact. Cranial nerve 7 is your facial cranial nerve. So this one, if you smile for me, and then wrinkle your eyebrows, excellent. So cranial nerve 7 is intact, and face was symmetrical. Cranial nerve 8 is your acoustic cranial nerve. So with this one, I'm going to do the finger rub. So I guess close your eyes and just tell me which side I'm rubbing.
My left.
Okay.
Right. Both.
Excellent. And then, in addition, we'll do our famous Weber and Ryan test. So just tell me which ear you're hearing. Both. Excellent. So no lateralization. And then we'll do the Ryan. So tell me if you can hear that.
Yep.
And tell me, just let me know when you can't.
Can't.
Can you still hear it?
Mm-hmm.
Okay. And can you hear that?
Mm-hmm.
Oh, sorry.
No.
Okay. Can you hear that?
Yeah.
Okay. So air conduction is greater than bone conduction with the Ryan test, and Weber, no lateralization. So cranial nerve 8 is intact. Cranial nerve 9, your glossopharyngeal, is 9 and 10, your vagus nerve as well. So this is where I will have you stick your tongue out and say ah.
Ah.
Okay, excellent. So uvula is at midline, soft palate intact, and then I'll have you swallow as well. Okay, and then I could also assess her gag reflex with this, but for this instance, we'll just verbalize it. So cranial nerves 9 and 10 are intact. Cranial nerve 11, so I'll have you shrug your shoulders, excellent, and no drooping, symmetric, and then shrug your shoulders against resistance. Okay, excellent. And then I'll have you, so try to turn your head that way against my resistance, and then excellent, and then turn your head that way. Okay, so sternocleidomastoid. So cranial nerve 11, the spinal accessory is intact. Then cranial nerve 12, the, I'm spacing the name, but I'll just have you stick out your tongue, and it is at midline, and hypoglossal is what it's called, cranial nerve 12, hypoglossal. And then I'll have you stick your tongue to the side of your cheek, testing the strength on your other side. Okay, so there's strength in your tongue. So all the cranial nerves are intact. So next, we are going to assess your balance and your gait and stuff like that. So I'll have you stand up. Let me see how we're doing. Let me kind of move this a little bit. I don't know. Probably won't be able to see very well. But, okay, so I'll have you walk forward for me. Okay, gait looks appropriate. And then, so turn around, and now you'll do a toe to heel, checking for balance here. I guess I'll get in the frame, sorry. Excellent, so balance is intact. So next, I'll have you go on your toes. Okay, and then as you turn around, go on your heels. Okay, so balance is intact there. So next, I might need to zoom this out a little. Hopefully you can still hear us. Let's see if I can adjust this. Okay, so next I will do the Romberg test. So I'll have you stick your arms out and then close your eyes and then just hold it there for a few seconds, assessing if there's any drooping, which there isn't. Okay, and then I'm going to do the pronator drift test. So continue to hold your arms out excellent. So they recovered. All right, you can relax them in your eyes. So excellent. So those were both normal findings. So next, oops, hopefully that's okay. So next I will have you just kind of sit, or I mean you can sit like that, but basically I'm just going to have you, so you pat your thighs and then bring your hands up and then do it backwards. Do it as well, and just alternate as fast as you can. Okay, excellent. And then, so next we are going to assess kind of your sensation. So, well first, basically I'm going to put your joint at and one of your arms or legs, one of your limbs, at an angle, and then you just have to mimic it with the other arm. So, so close your eyes, and then I'll just, kind of relax it and hold it there. Okay, do the same thing. Excellent. And then, let me do it with this one. So we'll kind of do the same thing. Excellent. So those are positive, or those are normal findings. So next we'll do kind of the same with your legs. So I guess I'll just kind of, so if you can relax it. All right, perfect. Okay, excellent. And then next I'm going to test. So basically I have this little paper clip, and just let me know if I'm touching you with one side of the paper clip or two. So we'll do it on your hands and on your arms.
Two. One.
We'll try it through your shirt.
One.
It's actually two, but that's all right. That's okay. And we'll do it on this side.
One. Two. One.
Excellent. And then I'll do the same on your legs and feet.
Oh, two. Two.
Okay.
One. Two.
See if you can feel through your...
Two. One.
Okay, excellent. So that sensation is intact. And next, I'm going to just test, let's see, where did our cotton ball go? Okay, so we're going to do, you're going to tell me if this is sharp or soft. So kind of the same thing. Assess kind of, your upper arms and your lower limbs. Okay, so.
Sharp. Sharp. Soft. Soft. Sharp. Sharp. Soft.
Okay. And then I could do the same up here in her biceps, but we won't do it. And then let me do it in your feet and legs.
You jumped on the bottom.
Don't?
You jumped on.
Oh, okay.
Sharp. Soft. Soft. Sharp.
Oops, sorry.
Okay.
It's hard to tell through the socks.
Sharp. Soft. Sharp. Soft.
Okay. And we could do it on the upper legs as well. So let me check. Let me keep your legs down for a second. Tell me if you can feel this vibrate, or can you feel that?
Yes.
Okay. Let me do it again.
Mm-hmm. Yep. Mm-hmm. Yep.
Okay. So feeling and sensation is intact. So next, I'm just going to kind of assess your strength and kind of your main muscles in your hands, arms, and legs. So first I'll have you kind of squeeze your finger, just your fingers, kind of squeeze just the fingers, and squeeze tight if you can. Okay, and then squeeze my hands, or squeeze tight. Okay, perfect. And then pull up against my arms, and then push down. So checking biceps and triceps, and then I'll have you kind of pull up your arms. Okay, and there's no drooping. Both sides bilaterally are strong. And then we'll check her quadriceps and her hamstrings. So pull up against my, excellent, and then pull down against my arms. So hamstrings and quadriceps are both bilaterally strong. And I'm measuring them against themselves to see if there's any one side or the other is weaker than the other. Okay, so, and then hips. So I'll have you lean back. And
Like lay back?
yeah, like lay back. And so basically, let me see if we're still in view here. And you can kind of bring your knees up. So with your hips, just try to push out against my arms. Okay, excellent. And then try to push in. All right, perfect. So, again, both sides are strong bilaterally. Okay. All right, and then lastly, let's just check some of your reflexes. So we're going to do your bicep, tricep first off. So let's do that. So we'll kind of have you relax your arm here. I'm just feeling for any contraction. Okay, be able to feel that. And then your tricep. Oops, sorry. Again, just feeling for any contraction. Excellent. All right, and let me do the same on this side. Relax. All right, and then. Okay, perfect. So I was able to feel the contraction there. Next, I'll do the patellar. So legs relaxed. Okay. Okay. Okay, and then the Achilles. All right. So excellent. And then let me do the Babinski foot. So basically, let me just have you lay back. I'm going to take your sock off, and then I'm just going to. Okay. I'm going to do the same on there. Okay. So sensation is intact throughout. So I think that concludes our assessment. So thank you for your assistance.
You're welcome.